Good evening, everybody. I think we have we've got a lot of people join us. Welcome everyone to this wonderful session that we have this evening on designing cities for vulnerable population. To give a little briefing for those people who have joined, who have been unable to join the previous one in the series that we had in June this year, which was about building healthy cities, an introductory of the series. This is in continuation with that. So keeping that healthy city discussion forward, this webinar particularly focuses on the vulnerable population. As per the Millennium Development Goals report of 2015, in India, we have 24% of population living in slums. That's roughly about 6.5 crore slum dwellers, and they are located in roughly about more than 2,500 towns across the country. Maharashtra, the state, has the highest share of it, followed by Andhra Pradesh. There have been numerous efforts that have happened in the past nationwide across various programs, finances coming in, the various donors putting money in implementing, providing basic facilities, providing redevelopment of slums, better housing, better sanitation, better water facility. A lot of these efforts have happened since many decades now. However, the post-pandemic world actually makes us realize, particularly in the light of the lot of difficult time that our vulnerable population and the urban poor faced over the last 5-6 months, that we need to really look at the vulnerable population, not something to look at as an afterthought. These are not people, or this is not the section of society we should just, address them when a problem arises. These are some things, this is that section of the society we have to very much integrate them and consider them when doing an overall city planning and management. Design interventions related to housing, access to water sanitation, appropriate social interaction. These are some things which are very, very critical, and they have become even more critical in today's time. Can we really afford to have shared water facility? Can we have shared sanitation facility? What about the housing facilities which accommodate, which are inhuman practically, and where a family of 10, 12 people are living in a very, very small houses across the slum areas of the country? How are we going to look at it? So these and many more questions like this will be answered in this webinar through our eminent panel that we have today here. Taking forward, and the focus of the entire discussion is how we are wanting to create a healthy habitat, a healthy living environment for these people. And that's how we are wanting to take this forward, and probably also address and share with you some very innovative models that cities can incorporate and address the needs of the vulnerable population. So with this, welcome everybody. I am Ashima from Anant National University, a professor and director from Masters of Urban Design program. And I am extremely delighted to introduce to you this eminent panel that we have. To begin with, we have with us Dr. Anuradha Jain. Anuradha is a clinical by formal training. She has worked with in this field over the last 15 years across various programs and international and national organizations, including USAID, and where she's been working for the last 5 years. She's contributed to operationalization of some of the very, very important key programs of government of India with relation to the health mission of India, and incorporated in the 12th five-year plan of the country. She also works towards strengthening the health systems to accomplish USAID's commitment to making universal health coverage a reality. She's her particular interest and work in the vulnerable sector is something that will bring in a lot of interesting debates and discussions in today's webinar. We look forward to that. We also have with us Dr. Damodar Bachani. Dr. Damodar has more than 40 years of experience in teaching community medicine across various medical colleges in the states of Rajasthan, Gujarat, and even Delhi. He's also been associated with Government of India's Ministry of Health and Family Welfare. He's also been the ex-Deputy Commissioner of the Ministry of Health and Family Welfare of Government of India. And in addition to that, he's currently the Deputy Project Director at the JSI Inc., under which he's heading the Deputy Project, as a Project Director, he's heading the Building Healthy Cities project that's funded by USAID. The project is covering cities, currently one city each from India, Indonesia, Vietnam, and also now going to be Nepal. And Dr. Bachani is going to share with us some very interesting insights from the case of Indore, which is the India case that is being worked on in this project. We have with us Dr. Renu Khosla. Renu, many of you might be aware, some of you are especially from this sector. Renu is the director from Center for Urban and Regional Excellence. She is particularly very keen to develop and think and imagine inclusive development using participatory processes for community development and local actions. She's worked a lot across various such communities, and especially bringing in the participatory approach mechanism and her in the entire ecosystem, and where she's kind of promotes people to be equal partners to the development and building resilience. We have with us URBZ today. Unfortunately, Matthias has been stuck up somewhere and he'll not be able to join in, but we do have Rahul with us. So Rahul and Matthias together founded this organization called URBZ, which contributes to urban research and actions with various collaborators across Mumbai, Goa, Sao Paulo, Bogota, Seoul, and Geneva. They've done an immense work. The reason Rahul brings strength to us is because of their immense work that they've done in Dharavi, which is the biggest slum of India. And he's trained as an anthropologist, and he brings with us to us on this panel today is the experience of the actual projects that they have implemented in Dharavi, and their experiences and the learnings from thereof. With this, I welcome you all once again. And now I would request to begin the session for today. I would request Anuradha to take it forward and maybe give your address. Anuradha.
Thank you, Ashima. I'll try and start my video, which I had put off. Thank you so much, Ashima, and thanks for introducing me to the group that is present here. I'm really grateful to the organizers for organizing this very important topic today, which is designing the cities for vulnerable population. And as you've heard, my name is Anuradha, and I have been working with USAID for the last 5 years. And in the last 5 years, the urban health is an area that has fascinated me. And I do not call myself at all an authority in the area, because I'm a learner still, and I'm learning every day, because the vulnerabilities in the city, and the city itself is an enigma that you have to unfold every day and learn from it. And so designing a city for the populations which are vulnerable is a very, very complex and complicated topic, but we'll try and add as much as possible we can, and make it simpler for the audience today. But what I would like to start off with is an example which itself shows the complexity of this problem. And the example that I would start with is that of a city where, for wellness, there were parks designed. And the city, the parks were usually in the evenings. It is expected that females, women, girls, children, they would come and visit this park. And this park was in the vicinity of a low middle income colony. But, unusually this park used to be very empty after 5:30, 6 o'clock. And so the people used to think that the women folk here and the children, they are more busy in the television. They are not interested in listening to, they are not interested in coming to park. They are actually not bothered about their wellness and things like that. But when, a small FGD was done in that population, what was found interesting was that the women and the girls told that they did not come to the park because the park did not have the roads did not have street light, and the parks did not have enough lights. And there were, there were people around in the park who were, of the criminal character, and these women would not prefer going to these parks to stroll in the evening, or on those roads to stroll in the evening. So what I'm trying to tell is that people who created that park probably didn't even, think that if they do not put these lights over there, the female folk and the girls and the children would not use, these parks. And that's just one example of the complexity that I am talking about. And thus, vulnerability of a population is something which is very contextual. It is very relative term, and it has to be assessed in the population size or the population areas where we are planning or deciding for a city. So, having a national program, having a state policy for vulnerability sometimes is a guideline, but then following it, planning it, and creating programs around it, it's something which needs to be very, very decentralized. And, it has to be very, very contextual. So on that note, I will start talking about this particular area. And, in the last 4 months, we all have felt that pinch, when our support systems were away, our house helps, our drivers, the hawkers around our houses. And somewhere these people are part of those vulnerable communities that we are going to discuss today. And the last 4 months in India has also seen the largest possible migrant movement in this country since 1947. So what I'm coming to is that even though I'm calling out this as a contextual problem, a relative problem, but still somewhere we have to define the scope of whom do we decide and call vulnerable, and whom do we, bring into this scope of designing in a city. And to bring things into context, what I would definitely ask the audience here is that, at some point of time, we all have faced discrimination. We all have faced exclusion. We all have faced biases in our life. But, we all get through those shocks in life, those disasters in life, and those discriminations in life. But unfortunately, the likelihood of a person who's marginalized and who's vulnerable, it is very difficult for that person to get through this shock. And the fragility that exists does not allow that person to come out of the shock most of the time. And this is where the whole vulnerability assessment comes into picture, and that person suffers because of his exclusion, because of its bias, the mistreatment he or she is undergoing, the stigma and the shame they are facing. So it's a complete somewhere violation of human rights when it comes to vulnerabilities. And the kind of environment that we create in the cities if it is not a cordial ecosystem, these people are actually left out. And refugees and migrants and people of those kinds, they suffer the most in these conditions. And that's exactly what happened during the COVID when the exodus happened. So the exodus happened because of certain reasons in the COVID times, and those were the vulnerable population who were actually looking for a support system. These support systems were lacking in the cities. They did not have healthcare, they did not have food, they did not have mental support. So what I'm coming and I'm summing it up as saying that it is the vulnerability of a person that in the city that uh, that leads a person to take certain decision to live a kind of life. And unless and until as planners we get into to understand the behaviors of such people, designing a system for them is very, very difficult. And the cities in our country are actually never been designed for low socioeconomic status people, and this discrimination unfortunately is visible since the time of Indus Valley civilization. So people who know history, more history than I know, would know that Indus Valley civilization and the Harappan civilization, they had two parts of a city. One was the upper city and one was the lower city. So if we had this kind of this kind of discrimination happening even at that time, imagine what is happening today when the cities are growing. There is a ripple effect. The populations that are vulnerable, how they are pushed outside towards the outskirts of a city because the land prices are going up, and the healthcare system which is designed for these people at that point of time when they were residing within the city remains there, whereas the people have now moved out of the periphery towards the periphery of the city. And there are still pockets of floating population that stay in the city that are very vulnerable. These are the rickshaw puller conglomeration, the shelter houses, the construction sites, and below overhead bridges, near railway station. These populations still reside there, but they are never the voices in the cities who are participating into the making of a city, the designing of a city, or a planning of a city. So there is a part of population that is pushed out, and there's a part which is in the city but is not participating in any of the decision making that is happening. And recently I met a city planner, and I asked the city planner that aren't we futuristic in designing cities? He said we are very futuristic. We design 10 or 20 years ahead of time. So I said, then why do we lag behind when it comes to city planning? So he said, by the time the plans start getting implemented, it is already 10 to 20 years ahead, and the city has grown many folds by then. So our plans are no more relevant to the times when we are planning. So the bottom line here is that the future planning has to be such, and the way it is implemented should be in time enough to decide for the city the way it is growing, and for those population that are becoming part of the city every day, every moment. And so a smart city, I mean, smart city is a buzzword these days. Just before we started this webinar, people were talking about another webinar that is happening, and the smart cities are participating. But the smart cities, they are supposed to gather evidence before they start planning for themselves, and they do gather evidence. So there are cities like Pune, Indore, who have done a community survey before they started designing the city. But unfortunately, when these surveys were done, the vulnerable population never have voices in these smart city planning, and so these populations do get left out. So what do we do as USAID in this whole process? So what we do as USAID in this whole process of addressing the vulnerability is that we have been, working in the area of urban health for the last 20 years. And we can very proudly say that the current National Urban Health Mission, in whatever form and shape it is, may be good or bad, is because of the work that we had done before it was launched in 2013, and it is our legacy and the work we had done for 15 years that had contributed to the formation of the National Urban Health Mission. And at USAID, we keep equity, we keep the quality, and we keep the access in the center of whatever design we make for the population living in the urban area. We do not create parallel system. We work very closely with the municipal government. We work very closely with the communities. We create that community connect with the system, and we ensure that whatever we do, we involve the local system or the local NGOs into that work, so that when we leave that work and we move out after some years, there is sustainability in that work, and the governments are able to work with that local system, and people are able to connect with that local system. As USAID, we really work towards achieving, improving the reach, the quality, the decreasing the proportionate out-of-pocket expenditure for people. Our integrated projects ensure that we take this complex vulnerability indexes into account and design and plan and help a city to design and plan according to it for the health of a mother, a child, and especially disabled in those geographies. Our work is very, very closely linked from national to state to municipal levels. At the national level, we work closely with Ministry of Health, Ministry of Urban Affairs, NITI Aayog, the National Health Authority, and we just don't work on. We do support government through our technical assistance, but on the other hand, we also work in private sector. We work on financing issues in the urban area, and we work on the innovation and technology side, which is very, very important and relevant to the urban context. Projects do aim that they become replicable, they work with the systems, and we have projects called the Partnership for Affordable Healthcare and Access and Longevity. In short, we call it PEHL, which actually contributes to decreasing the proportionate out-of-pocket expenditure and helps the IBMs, which is the small business models in healthcare, to grow and to provide that affordable healthcare to the most vulnerable and poor populations. They also provide some kind of microfinancing to these growing structures in private sector in the urban areas to make them self-sufficient. We have a new project coming up, Samagra, which would be working on the social determinants, on the access and the governance side of the urban health. We have a project called the Vadhvani Institute, with Vadhvani Institute, which is called the Scale Project, and it looked towards the technology and inbuilt technology integration into the health system by creating telemedicine, bringing in vending machines, point of care diagnostics, and we have projects that are working on adolescence issues in the urban area. The Building Healthy City project that we have is a very, very uniquely placed project in this whole ecosystem of the other projects that we have, and it works towards the inclusion efforts of raising the voices of most poor and vulnerable, so their needs are met, as well as working on the other end of the spectrum with municipal leaders, planning, budgetary inclusion, and bringing in the citizen voices to improve governance in these places. The COVID has actually taught us that disease has no boundaries, and unless and until we have a resilient health system, especially comprehensive primary healthcare system, which is the backbone of the health system, we will not be able to take up the shocks, will not be able to deal with the pandemics in this country.
Absolutely, right.
And as USAID, we are dedicated to support our governments. We are dedicated to support the private sector in this country to make the system, the health system, very, very resilient. And with that, I think I'll take a pause and hand it over back to Ashima, thanking her again for giving me this opportunity, and let's make the most out of it.
Absolutely. Thank you. Thank you, Anuradha. I think that was a very interesting. I mean, it's impressive to see, and donor agencies and donor are very, very important to a nation like India, have always been, and USA had been doing tremendous work. Thank you for taking us through the entire, the plethora of things that USAID is part of. This was really very interesting. You did raise a couple of very interesting pointers. I'll come back to that a little later in our discussion. For now, I think we are already short up the time, and we'll move to the next presenter. And now we have with us Dr. Damodar Bachani, and Dr. Damodar will take us through the Building Healthy Cities project, and the kind of what kind of impacts and what are the results that are coming out from the study that they've done under this. And before we begin with the presentation, Damodar will play a small video just to brief you about what the Building Healthy Cities project is.
Reduce the risk of disease. Urban planning can create major health risks, or it can foster healthier environments that reduce the risk of disease. What are the steps urban planners can use to plan for a healthy city? This is difficult to answer because of the complexity of urban life. JSI and partners through the USAID-funded Building Healthy Cities project are testing innovative approaches to incorporating health goals into urban planning approaches. With 3 collaborating cities in Asia, these cities were chosen because they are growing fast and represent diverse contexts. They are also smart cities, so they are already committed to investing in infrastructure and information technology to improve the quality of life of their citizens. The Building Healthy Cities project is advising each city on ways to embed a health focus into their plans for city expansion, or in other words, practice healthy urban planning. As a first step, the Building Healthy Cities project is mapping each city's characteristics and needs. With full participation of city's officials and community members, this systems mapping is then used to identify the best opportunities to change the urban system in a positive way. The result is a common agenda and a list of priorities that have the best chance for improving the lives of all citizens in growing cities. Building Healthy Cities and our city partners use this information to define and fund people-focused activities such as smarter health services, increased data sharing, safer food preparation, air quality monitoring, healthy tourism, health promoting schools, and citizen reporting systems that all citizens can access. Building Healthy Cities is also training vulnerable citizens to advocate for better access to city services. By bringing people together to develop common goals for healthy urban planning, the Building Healthy Cities project's activities will improve and prolong lives among city residents in Asia. We will share what we learn to help other cities decide on potential solutions for their own context. Follow us to learn more about the Building Healthy Cities project and how it is improving people's health.
Over to you, Damodar.
Thank you, Ashima, for this presentation video.
Yeah, we'll just put up your presentation now.
Yeah, this video gives you an overview of what we have been doing. in the 3 cities. But today my main focus would be on urban poor communities, giving you experiences of Indore in India. Next, please. This, of course, you have seen the 3 cities, but now we have added Kathmandu in Nepal, mainly focusing on just one particular activity, that is controlling air pollution. Also, you will see here that this project focuses on 4 sustainable development goals, including reduce inequalities. And that is focusing on how we can bring parity between urban poor and the other sections of the cities. Next. The 3 main strategies are multi-sectoral engagement. So it's not a health system strengthening project. It's more on social and environmental determinants of health and how a city could make plans that will benefit the health of the citizens. Also, data-driven learning. You know, many sectors have their own data systems. There's no sort of approach towards integration of this data and using for focused planning and resource allocation. And the third important strategy is citizen empowerment, particularly urban poor communities. And the activities that you saw in the video include most of these around environmental health, like air pollution control, skills building, particularly of health sector, HR, access to services in the urban poor communities towards equity. We also have a very good project on health promoting schools in Indore, where 148 schools have been included. Next, please. Indore has been in the news for the last 4 years. It's a growing commercial capital of MP, a central province of India, with the approximate population of 2.5 million. But 30% of the population lives in slums, and other urban poor communities include migrants. This is roughly 0.8 million or so. There are more than 600 clusters of small slums across the city. Indore was in news even recently, winning the best city in terms of cleanliness. So the cleanest city of India tag for last 4 years now in running. And that has been one very positive aspect of the city around which we are trying to build up how the citizens' engagement could be further leveraged for other activities. There's a formal MOU with the Indore Smart City Development Limited for implementation of this project. Next, please. Just looking at some of the data that we got in our baseline surveys that was shown in the video. In the urban slums, we have 54% houses which have concrete roofs. So that's a big number, that 46% of the households today in urban slums only do not have concrete roofs. That's one challenge that city government is facing. Piped water supply is available to 53% population only, remaining depend mainly on either the groundwater resources or also the tankers supplying drinking water in the slums. The city has a sewage system, but it covers only 150 out of 275 million liters per day. And that is just over 50%. And the remaining wastewater goes into the open drains and ultimately into Khan River, which is more of a big drain rather than a river. That's another big challenge. And communities living close to these drains face environmental challenges. While Indore has an LPG system covering 94% of households, but Renu will tell more about it. They have LPG connections, but they do use biofuels now and then also, and that poses problem in terms of household air pollution. Green spaces and parks are more visible in the non-slum residential areas and only 38% in the slums. Education, overall literacy is quite high, but if you look at the facilities like playgrounds, it's available only in more than just over half of schools. And so we do really wonder how the children should play outdoor games and sports. Healthcare facilities, as Anuradha was saying, is inadequate, particularly in the urban poor communities. and therefore people prefer to go to the private facilities even though they have to pay. And we are focusing quite a bit on this, and we got 10 urban primary health center assessed and told the city governments, both the health department and the city administration, what steps should be taken to improve the healthcare services. I'll talk more about the Indore 311 app, which is a very good system of grievance redressal, in the next slide. Next slide, please. Yeah, so this has become a landmark in Indore. 311 app was started in 2016, and over the years, this has become a major vehicle for registering the complaints and redressal thereof. There are dedicated teams in the office which takes care of these grievances and address them as early as possible. But we did find in our survey that there is a difference in the type of complaint that slum dwellers register compared to others. Like if you see here, 42% of complaints were around wastewater. The drains were clogged, particularly in rainy season. Currently, we have a lot of videos which show overflowing lanes full of water, and even the sewage system is overflowing. Electricity failure, particularly street light not working, was one of the major complaints, both in slums as well as in other areas. Though they have a very good solid waste management system, more than 500 vehicles are engaged on a daily basis, collecting segregated dry and wet. Mind it, segregated dry waste at the source, at domestic level. And these 500 plus vehicles collect these garbage and convert, dry one is converted into fertilizers and the wet one into energy. That has been a very, very important, I would say, one of the main features of why city was said the cleanest city. You will not find garbage here and there. But still people do complain and actions are taken. Drinking water, there have been some complaints around that, particularly during the rainy season. Next, please. We also did a survey in 2018, next one please, around non-communicable disease risk factors, because we knew that urban population is having these risk of diabetes, hypertension, cancers, and other diseases. And this survey revealed quite revealing facts. We did analyze for lowest quintile versus the highest quintile, which is reflected here. And as you can see, tobacco is a big problem, both among men and women living in urban slums. 27% women in slums were using tobacco, mostly non-smoking forms, that's chewing tobacco. Alcohol was not a big problem in this particular survey, but you have some other features like excess salt intake, which is a very important risk factor for hypertension, more visible in slums compared to non-slums. We think that overweight, hypertension, and diabetes risk is more an rich population risk, but here this data shows that no, it's not so. Even the poor communities, both men and women in the slums and other urban poor pockets, have 38% obesity among men and 43% among women, and even hypertension and blood sugar, high blood sugar, was a little less than the 20% highest population, but it was not less. I mean, it is more than the national average of 10% diabetes and 30% hypertension. So this shows that it's not an urban rich phenomena. We have to think of educating the masses about reducing the risk towards non-communicable diseases. You have seen this particular infographic which summarizes what all we are doing it, so I can skip it. Next, please. And this is the crux of the whole thing. Based on the baseline survey, we held number of workshops on theory of context, on theory of change, trying to identify leverage points where city should take action, and then collective actions across the city and also sector-wise. And that is being shared with the city government. that these are the actions if you take in various sectors, then the city is likely to develop not only healthy, but also clean and livable. That's it from my side. Thank you very much. If you want to know more about it, do write to us.
Thank you very much, Damodar. I think a few of the pointers which was very striking to see is the kind of health risks that are available in the vulnerable population that you saw in Indore. And it was heartening to know really the kind of efforts that are being done in terms of garbage segregation and cleanliness in the city of Indore, not just in the non-slum area, but also in the slums area, which is very good. It's almost like like an inspiration for the other cities to probably do something. So it's not something that cannot be achieved. Very nice. Thank you very much, Damodar, for that presentation. Thank you. And now we will move to Renu. Renu has also been, through her organization, CURE, is also part of the Building Healthy Cities project. And correct me if I'm wrong, Renu, in that she's been contributing into bringing in the public participation and engaging the community towards data collection and awareness and approach towards building their the habitations which are more healthy, livable habitats. Over to you, Renu. We'll just begin your presentation.
So basically, you know, our new future mantra is Atmanirbhar Bharat. Gosh, we need to get to the first slide. Can you get to slide 1, please? Yeah.
Yes.
Thank you. Okay. We are building a self-reliant India. And how do we make this magic happen? Who's going to make this magic happen? Are healthy cities the answer? Can we make our cities more just, more fair, more equal? I think that's the question that we need to ask ourselves. Can city planning help us to put an end to what people have been talking before? Anuradha and Damodar have been talking about the inequality, the exclusion, the vulnerabilities that people are facing. I just want to, next slide please, I just want to share 2 different statistics with you. The first is 7%. 7% is the contribution of urban poor to India's GDP. They are not unimportant people. They power not just our urban economies, they also power our rural economies by the remittances that they send back into the rural areas. They are the reason why a lot of services are at our doorstep. A lot of services have become affordable because they provide quote unquote cheap labor, yet these are the hidden people in our cities. Next please. The figure that I just want to place here is that almost 6% of our GDP is lost because we don't have adequate sanitation facilities provided to the communities. Now, when we put the 2 together, that's a huge number. 10 to 12% of India's GDP is because of the poor, and look at the losses that we are incurring by not providing them an equal level of services. Next, please. And the consequences of bad water and sanitation is bad health, but it is also bad productivity. And the consequences are both for the city and for the individual. The individual faces, the individual loses his daily wage or her daily wage when she is not able to go to work because she's sick, and or trying to access services that are not very close by. And the city faces the cost because they have to invest in more health care services. So they have to provide more health infrastructure, they have to uh, reach out and expand their coverage. So bad water and sanitation has serious consequences, and therefore it's an urgent need to take to take cognizance of this fact and then to plan accordingly. Next, please. So from Cure's perspective, what do we consider inadequate water and sanitation, or what do we say what is adequate water and sanitation? So adequate water and sanitation would mean getting taps and toilets at home for the poor people. Not shared, as Ashim mentioned, not shared, not in a public or a common space, but in their own homes and connected to an infrastructure which provides a near equal experience of having a toilet, which is simplified sewers or networks where these taps and toilets get connected. And we are and it's not just about the home getting connected, it's also about making sure that all that sanitation value chain gets connected and the sewage flows to where it needs to be treated and where it then makes a city healthy. But why are the poor, why do we have bad water and sanitation in communities? That's because they are in bad geographies. They are usually along drainage channels, railway lines, roadsides, in industrial areas, riverbeds. They also have bad geographies. They have bad geographies and they are not very easy to bring infrastructure into because of the very organic nature of their growth, and therefore bringing in a regular waste collection service or provisioning of toilets or sewerage becomes harder over here. At the same time, they are in the city's blind spots. They are not visible, and there are a lot of legacy practices that make them invisible. For example, they do not have land ownership. They're living on land which is considered illegal, and therefore the city is unable to provide services into these areas. The city has the practice of providing a one-size-fits-all solution. And their approach to delivery of service is very paternalistic. It's take it or leave it kind of an attitude, and though there are no democratic spaces where they would like to listen and hear, where they can listen to the voices of the people. Next, please. So with the JSI, the project is in Indore about creating community agency. It is about empowering the people to generate their own information, generate their own data, and to then be able to use that information to negotiate with the city. Next, please. If you look at the city of Indore, it has, as Damodar said, more than 600 slums. But if you look, so what we did as part of the project was to pick 9 slums or settlements where we thought that the geography of the city, the physical features of the city would actually be adding to their health challenges and their health impacts. Yes, you can take it to the next one, please. So what was our, so these the challenges that we picked up were, we picked slums inside industrial areas, slums that are along riversides or nalas, drainage, and where could be near garbage dumps, or near the railway tracks and railway lines. So the approach that we adopted, or the approach that is in process now, is about engaging, building their capabilities to generate the data. When they generate the data, they would own this information and they would reflect on this information to understand what could be the possible solutions. And then there is agency strengthening, where then the community meets up with the service providers and negotiates for what is their right to the city. Next, please. So if we look at the nuanced concerns, some of these were mentioned by Damodar. Some of the nuanced concerns come up when you talk to the people. And that's when you come to know that a squeaky clean city, Indore, for the last 4 years, has irregular solid waste collection, which happens once in 3 days in the slums, or that the open drains are choked, are choking from the sludge that is flowing into them, or that the water is polluted because the industry is pumping their pollutants into the city water, into the ground, or that the Narmada pipelines have been provided, but there is no water into that. So, and that even if you rebuild the housing for some people, the housing is so small, and the toilet doesn't have the airing, the airiness or the ventilation, so that nobody can sit inside when somebody else is using the toilet, and therefore it becomes pointless to have a household toilet. So the other concerns on the health services are how far they are, how bad the service is at the public hospital. There are the missing frontline workers, they don't have the Ayushman Bharat card. So these are the small nuances that emerge when you talk to the people, and what Anuradha mentioned, that this is what brings localism into the whole planning process. And all of this got interrupted by COVID, when people had less food to eat or no food to eat, that they became unemployed, or that there was desperate employment. Women and children were particularly impacted, and they don't have technology or IT skills to be able to, connect with the kind of services that you and I have been able to do, or even to participate in the education process, or access the subsidies. Their mobility was a challenge in case of health emergencies. And there has been a rise in all forms of abuse during the lockdown. And healthcare has been interrupted. So people who have tuberculosis have not been able to get to the hospital to get their regular dose of TB medicine. So those are, again, bigger, a second pandemic, which is not the COVID-19, awaits us when we delay treatment for some of these cases. Next, please. So let me just take a quick pause here to tell you who we are. CURE, the Center for Urban and Regional Excellence. We are a development organization. We actually call ourselves an unthinking organization, because we try and incubate and de-engineer solutions for urban poor communities that would level them up, that would connect the entire value chain, and that would be comprehensive, or which follow an ecosystem-based approach. Next, please. Let me just, and as you said, at the core of our work is a community-led, ecological, ecosystem-based approach to delivery of water and sanitation. And I'm going to give you 5 models very quickly on how this approach works. Next, please. If you look at our ecological approach is about creating partnership with the community for example, in developing community rainwater harvesting systems, which have been done in the city of Agra, where the community has partnered with us and is not just being part of the planning, the design, the implementation, but is also maintaining and managing these 7 huge community rainwater harvesting tanks. These are generating 1 million liters of water per rain. Annually. They have made the communities and the schools in which they have come up resilient. They're saving the city almost 35 crore rupees per month in pumping, in treating water, in supplying through tankers. Our school enrollments have started increasing. The household has begun to save money because they've got better health and they're not purchasing water anymore. There is social empowerment. So there's a whole range of impacts that come up in this collective rainwater harvesting effort, which is what Agra as a city or any city now needs, because the city lacks the water. The water is missing. I mean, the water, they're going dry. They're desertifying. Next, please. Another model that Cure does is of the simplified sewer system. So there's a simplified infrastructure, which are shallow bore sewers, small and thin, which can go into the small gullies, narrow and irregular gullies, so that and once you provide this kind of a sewer line which gets connected to the city's sewer system and or to a shared septic tank, people build their own toilets and invest in these toilets, invest in the upgrading of their home. Next, please. We do the decentralized wastewater treatment systems, which actually create a cleaner experience and which lead to better investments in improving pathways. So these are the nalas that flow on the sides of or can be cleaned up, and then the water can be repurposed. Next, please. We also have done a school resilience project, which we are working currently, where we are actually looking at the whole circular economy of the water and sanitation system, where you fix the toilets, you use the hand washing water, you treat that water, you harvest rain into the water tanks, and then you use the food in the school food waste in the school, you compost it, and then you add to the nutritive value by doing some vegetable gardening. So these are our resilient schools that have come up in Delhi and have become preferred schools of the communities in that area. Next, please. And I'm going to very quickly wrap this up. One of the strengths of Cure is that we do data-driven planning. We spatialize information. Next, please. We spatialize information, and we have developed what is called an URBGov. URBGov or urban governance. It is a tool that it's a decision-making assistant for local governments, and it uses IT solutions, it uses algorithms to help cities target their investments, to invest wisely. For simply put, if they know where if the city knows that it needs 10 toilets, it doesn't know where to locate them. So it's only when you, the information with cities is in broadsheets, and it's in spreadsheets. It's not on spatial, it's not spatially laid out. And that's why you'd probably end up seeing 2 toilets very close to each other, whereas there will be areas that have not been covered. And then the whole political economy kicks in of decision making. So this is something that makes decisions transparent, and the government saves and becomes more effective. Finally, if I can just sum up what I think, if we have to make the next slide, please. If we have to make healthy cities healthier, if we have to make it possible to make next slide, please. There are 5 key components of making this Atmanirbhar Bharat possible. One is we need to have collective planning, engage with people, empower them, build their agency, understand their issues, challenges. We need to include them in the city plans so that so that we can level them up. We bring to them a level of services that is equivalent to the rest of the city. The solutions have to be localized. They have to be de-engineered. They can't be big infrastructure. They have to be simplified solutions that can fit into the whole geography of a slum. It has to also make people partners in this whole ecological process where they learn to manage, maintain, and sustain the ecology of their area. And this change is not going to happen overnight. So we need to incrementally change the systems that work in the cities. Next, please. I think post-COVID, as I said, on the other side of COVID, let us try and build back fairer. Thank you.
Thank you very much, Renu. That was an excellent view, and I think a lot of things that you said were also in line with some of the things that Anuradha was talking in terms of localized approaches, kind of keeping these people engaged, and we are all kind of talking about the same situation. And it was good to see actual implementation of these activities. I think that's what was really impressive. The work that Cure is doing at Agra, what you did, and the decentralized wastewater, building those resilient schools. I think we need more such a multiplier effect of such efforts that needs to be done. And it's definitely not going to be one size fits all. It will have to be specially catered to a particular situation. But still, I mean, the approach has to begin, and it should not stop. Like you said, it has to be an incremental, and it has to keep on going. One has to fire the other. With that, let me now quickly move to the next presentation. We have with us Rahul Srivastava from URBZ, and Rahul brings with him immense experience that he's had from his organization side to working in Dharavi. And like Renu, Rahul, we are looking forward to some real on-ground achievements and the experiments and some successes, such failures, whatever that you faced, and draw learnings from that. Over to you, Rahul. You are on mute, Rahul. You need to unmute yourself.
Sorry. Yeah. So thank you very much, Professor Ashima, for inviting me to this forum. And Dr. Renu, it is a wonderful presentation you made, because it really segues very clearly into what we do. And I know that we have a time limitation, and I had made a presentation for 10 minutes. So I'll quickly go on to the presentation. I think somebody has to put it on.
Yeah, we are just.
So while the yeah, no problem. So I would also, because we are located in Dharavi, I would request all the participants, whenever they have the time, to look at our website, urbz.net. The only reason I'm asking you to do that is because we have produced about 15 very quick updates from Dharavi during the entire pandemic period, starting from March until now. And it's an ongoing series. And we have been trying to understand the impact of the COVID, and through that understand the vulnerabilities of the existing health infrastructure. For us, health has always been, for any urban practitioner, especially working in vulnerable cities, in vulnerable neighborhoods, health has been a very interesting and important value neutral space. It allows a greater level of involvement and agency from the part of the government, the bureaucracy, from local residents, etc., because that's one space which becomes the least contentious as far as investing is concerned, as far as sort of being proactive about talking about the neighborhood's infrastructure is concerned. So in that sense, for us, health is a very important part of the larger world. And I'll explain to you in terms of some of the projects which we have done. Can we go to the next slide? So, yeah. So this is a small project we try to do. This is Kumbharwada, which is in a neighborhood, one of the oldest neighborhoods in Dharavi. It is one of the earliest settlements. It is, again, it would be wrong to call it a slum. Like that neighborhood is that label is a problematic one, particularly, and this is particularly true of Kumbharwada, because the Kumbhars were given legal tenure to occupy the space, when they had come in the early 20th century. And the thing is that for them, the presence of the hearth has been a very important part of their economic livelihood. And that has itself been the cause of huge amounts of health issues because of the amount of pollution which it causes. And the fact is that that pollution is also linked to the lack of clean fuels. So we said that, okay, given the limitations everybody has, let's try and together with the community come up with solutions. Can we go to the next slide, please? Yeah. Yes. So so what we did is that with our we often do a lot of work with students, and these are students from the NYU Abu Dhabi campus. They had come here, they took on the challenge. They said, let's try and understand exactly what are the causes of pollution, what is the way in which we can factor in the very important livelihood concerns which the locals have. Obviously you cannot give up the hearth. The hearth is going to be part of the landscape. And yeah, you can keep moving to the next slide. We'll do it quickly. So, so this was a prototype of a chimney which emerged with consultancy with the local residents. Why exactly they felt, what exactly were their particular needs? Now, I must say that the models which emerged in a very brief period of time, and they were not very successful. The reason being that we could not have even a semi-permanent structure. You stick to that earlier one, please. We could not have we could not even have a semi-permanent structure because the space in front is often to be kept for access to public events, particularly festivals and marriages. So whatever intervention had to be there, even the hearth itself gets dismantled during those moments. So we knew that there are certain cultural wirings in their entire neighborhood, which also has to be factored in. So as a result, the prototype was not necessarily very successful, but this is just to show you the kind of things we have done. Let's go to the next slide now. Yeah, these are models of houses which we have been designing. And the idea of talking about this is to show that we feel it's very important to validate the neighborhood itself. One reason why Kumbharwada is often not as invested in improving the infrastructure, in spite of it generating a lot of revenue for itself, is because the neighborhood itself is not validated. People come to it thinking that it is a slum. The residents themselves, are from marginal communities, and they feel that there is no real attention paid to the context in which they produce. So people will come and value the pottery, but they will not necessarily relate to the habitat around it. So for us as URBS, it's very important to create some kind of a validation of the habitat as a whole. And so this exhibition, which we are showing right now in this slide, and the next slide, please, is part of a project called Design Comes As We Build, in which we began to tell people that, see, working from home is often not a choice, but it is a compulsion for a lot of people, and that it also has a certain kind of validity. And the entire typology of a neighborhood like Dharavi is basically based on this idea of working from home. And we call this tool house. Also, the more validate this form, then there is an attempt given to improve the infrastructure. Our success stroke failure in terms of investing in the whole health crisis of Kumbharwada was essentially linked to the fact that the habitat as a whole was not given much respect and validation. By focusing and spotlighting the whole idea of working from home, we began to show that there can be improvements in design, and these improvements in design will therefore feed back into into even improving the infrastructure. So we hope that through the Design Comes As We Build project, a focus on the habitat, then we can return back to Kumbharwada and in a more holistic way help in the transformation of the neighborhood. Let's go to the next slide. Yeah. So these are examples of these tool houses have been essentially designed. These models have been designed by local contractors who build. Our whole idea is that the improvement of infrastructure, civic infrastructure, is best done by the residents themselves, as we have seen in the earlier presentation. And there are also active agents, there are actors, and in this case they're the social contractors, whom we call social contractors because they're from the neighborhood. And these contractors essentially are extremely skilled in terms of construction and building, but we don't validate them. So how can we expect an improvement of the infrastructure when the main agents are not necessarily encouraged? So, so by highlighting the design of the social contractors and then also asking the artisans from the neighborhood. So on the right hand side, you see the model of the house. The house has been actually baked and constructed. The model has been baked and constructed by the Kumbharwada by a Kumbhar in Kumbharwada. So this is also a way of validating the skill itself. Let's go to the next slide, please. Yeah. Now this is a typical photograph of a community toilet in Dharavi. And we felt that there was, again, not much importance given to the physical quality of it, its use. And so we went and helped with the help of the local residents and contractors. We designed a community space which could be built on top of this toilet. Now, this design, won awards, etc., but we could not really succeed in implementing the community space. Why? Because we could not get permission to do so. And but at the same time, putting a spotlight on the toilet and winning the competition helped to give a lot of confidence to improve the maintenance of the toilet itself. Can you go to the next slide, please? So the residents themselves were motivated and they helped to clean up and transform the toilet from its earlier very shabby condition to something better, because we were anticipating that the process would continue and we would be able to build on that infrastructure. Let's go to the next, but unfortunately that could not happen. This toilet is a different one, but this is also shows a similar story. There was no water in this toilet. The reason being, let's stick to the same slide, please. We did not, there was no water in the toilet because even though the toilet was built, the BMC did not provide a water supply. So what we did is essentially, we found that there are lots of wells. As you already saw in the next slide, there was a well in Dharavi. There are many wells in Dharavi. Not all of it is obviously potable because of the huge density of habitats, but the water is, as a resource, exists. And by spotlighting the wells also as a possible use of, of non-potable water, especially for toilets, etc., we actually connected a well, an underground well, to that toilet. Just making that connection again transformed the whole locality and the neighborhood's understanding of that toilet, which was earlier just abandoned. And so by actually doing it and implementing it and bringing in the well water, we managed to make the toilet also active. Let's go to the next slide, please. I think that's, yeah. So, so essentially our focus, these are again the students who have been working with us. Now we have a team of architects, designers, urban planners, but we work very closely in Dharavi. We believe that it's important to set our office and our location, our studio in the context of in which we work. And we felt that, we feel very strongly that having a pragmatic, practical approach is a very important one. Showing and demonstrating how incremental improvements in infrastructure can happen by recognizing local talent and harnessing and building that talent into actual projects is the best way to move ahead. So there are a lot of things, like I said earlier, that health is a value neutral, very powerful way of justifying a lot of intervention. And but we have to harness it in the right way. And one way of doing that is by actually actively working with communities on an ongoing basis. So for us, it's very important that our office is based there. We work on an everyday basis. Almost everybody in the, in many neighborhoods in Dharavi relate to us. They know us. They know they can come to us for consultancy. They can come to us for design, etc. And then we address different issues, both in terms of architectural inputs, improvements of the habitat, but also issues which are linked to health. All of them in a holistic manner. So, sorry, excuse it is Ganesh Chaturthi in Goa today, where I am, and it's a big festival here. So, so essentially, our approach has been to be as pragmatic as possible. We feel that there is a lot of discourse which goes around. There's a lot of discourse which goes around having active engagements, but we don't have demonstratable models which can be practical. And we really need to multiply these models. We really need to develop a practice which is located in context which we are addressing, rather than see the neighborhoods as places which need special intervention. It is important to understand that they are very much part of our urban landscape, and that we need to enter into that space and create a narrative of co-working, co-designing, and involving their engagement in very pragmatic ways. And small projects can go a very long way in developing faith, in providing a sense of validation both to the neighborhood, and then slowly over a period of time we see transformations. So I'd like to end over there, and then perhaps we can take up more for discussion.
Thank you, Rahul. That was very interesting to look at that, connecting the well to the toilets, to to address the whole issue of water not being there. I think that was like utilizing the local resources, and your point of particularly validating the local artisans and that using the local people. I think that's what we are all been talking about, and it's good that people do talk about these things a lot, but you actually made it happen. And I hope this can be more successfully incorporated, not just in Dharavi, definitely there it's required, but most other places as well. One another very interesting thing I would want to highlight here, what you pointed out, design comes as we build. And I think that's really something very interesting, and that's something takeaway from your presentation that I would have. It's also kind of in sync with something that Christopher Alexander, kind of promotes in all his principles and teachings and learnings. So Christopher Alexander, though he's a mathematician, but he's known for transforming urban communities and informing a lot of principles, fundamentals that we use for city design even today. So that, I think that's something that that can be very well done, and especially for this community for which this whole process of incremental development is very, very critical. Thank you. With that note, I think this was a great set of presentations, and we already have lots of questions in our Q&A and in the chat also. Some people have written down. I'll just now I'll just try to be as quick and as brief. I'll also overlap some of the questions and maybe address it to you one-on-ones at places. I would want to begin by, since Rahul, you were the last one, maybe touch base from you. When you said the validation of the habitation that's required, and the validating of the local artisans and the local resources available, we need to harness the local talent, but that does not really happen. So slums are still taken as an eyesore. Where are we really lacking when it comes to considering slums to be thought of while thinking about a lot of other things in the city? Why does it come as an afterthought? What can we do so that it does not come as an afterthought?
Right. I think it's a very important point. There are two major reasons in our research which we found and our practice which answer this question. One is the fact that we always have a very subtle bias towards owning property in cities, and anybody who cannot afford to own property is somehow put in an insecure tenure. At one point of time, ownership was not necessarily the only way in which we could live in cities. So workers, etc., we all had, many of us growing up in the 70s and 80s, there were government infrastructure which, in a sense, accepted the fact that when workers come, whether there's the railways, whether there's the, even a industry which has come up in a small town, it is a responsibility for everyone to make sure that all the migrant workers who come actually are provided accommodation. So it was seen to be a natural path in many ways of urban growth. And many of our so-called slums actually have historically been villages. In Bombay, it is very, very true. These are, urban villages which have lost their status, as it were. And then they have become the nuclei around which a lot of slum neighborhoods have grown. Then, as an anthropologist, I can very confidently say that in India, due to social prejudices and due to the existence of hierarchies connected to caste, Some neighborhoods are never given attention to. Some neighborhoods are given a lot of attention to. So if you look very carefully at the transformation of many cities, post say 1947, after the partition, lot of refugees who came to different neighborhoods in the city, their transformation can be mapped out in terms of the social history. Those who were very poor, those neighborhoods actually became classified in the narrative of the slum more easily. Those who are part of middle class and they had some capital, those neighborhoods will never be called a slum. They transformed over 20, 30 years. But if you look at every migrant today in any city, you will find that they represent that moment in time. And all they need is a toehold which can transform into something very, very powerful for their lives, in terms of their livelihood, in terms of settling down in the city, so on and so forth. This process of accommodating people is a very important part of urban planning. So the more we have worked in neighborhoods like Dharavi, the more we realize there is a difference between the narrative of housing and the narrative of accommodation. And we feel that even the housing narrative has made it so blurry that there are no real clear-cut policies for people who cannot afford, and they cannot be part of the whole, all the targeted intentions of slum improvement. Whereas the focus often which many people have is of accommodation. We need a place where we can live and work. And this nuanced understanding between the two, to my mind, is a very, very important and crucial way in which we can get rid of this prejudiced way in which we look at slums. We need to simply accept that workers and people who come to the city need accommodation. And this need for accommodation is a dignified need. It should be responded to like everything else, just like we produce infrastructure, for transport, for railway stations or whatever, we have to also produce for migrant workers. So this is the way I would sort of answer that question. Why are we not doing it? The one reason is because there is a lot of bias in the way we look at this whole space of migration and urban context. And the moment we remove this bias, remove this prejudiced eye, you will realize that, well, there can be interventions made in a very, very simple way. It is not resource intensive. It is not something, we have to validate that habitat in so many different ways. So yeah, that would be my answer to the question.
I think that was very well put, and that brings me to something that Renu was also talking about. Renu, you did talk about the legacy that exists in city administration, and because of which these community places, these communities, these pockets in the city are often left out. Would you want to, kind of elaborate a little bit on that?
One of the things that we found, Ashima, in our work is that, we work with communities, we plan with communities. We are not able to create that pathway which takes the plans of the community to the city authorities and we are unable to integrate or get that plan integrated into the city plans. And so therefore, in the end, the whole planning exercise becomes just an exercise because it is not responding to the needs of the people, and it is and the solutions that the city is bringing in are not solutions that the community believes are going to work in their context. So these legacies come from several sources. One is the fact that there are systems in governments which are used for procuring services, procuring contracts. Now, if you need to build a water pipeline and take it inside a slum, there is a BOQ, a bill of quantities, which is what it is called, where a set of defined intervention, possible interventions are there, against which a certain allocation of, financial budgetary allocation is made, or a cost per rate is put. Now, if you go beyond that, there is no precedence, and therefore city governments are unable to innovate or implement solutions. So that's part of their legacy, which comes from the administrative and financial systems which bind them, which prevent them from taking those decisions. It becomes easy. It's laziness. It's mental laziness. You don't really want to, kind of come out of your comfort zone. You don't want at the end of the day, somebody coming and telling you, look, this was overpriced or underpriced or something. The second problem that comes in participatory planning and city engagement is the fact that participation takes time. It is not something that can be done. It's not rapid fire, and cities don't have that luxury of time because they're constantly chasing budgets. They've received their budgets in the month of January or February, which need to be kind of spent by March. So
even if sometimes they have time, they don't even have capacities. They don't understand how to do it.
Yeah, exactly.
I think that's another aspect. They don't have capacity.
That's a very, very crucial aspect. I don't think city governments are made up of engineers, right? And mostly male engineers. I can bring a little gender perspective over here. And if it's a man designing for a slum, it's not his concern that water has to be at home because the man is not responsible for water collection. A man can go and pee anywhere. A woman needs a private space and a toilet. So they have to understand what are the needs of a particular community, culture, gender, and then. They're made up of engineers. They don't know how to do social engagement. So they need to work with civil society, and they don't know how to. They don't have any precedence on how.
But why can't Renu? That brings me to the whole fact that we have the 74th Amendment Act, which does empower the local urban local bodies. Why can't community help groups or self-help groups kind of get activated to take this forward? I mean, would that not be really better that every community takes care of their own?
Yeah, the problem is because the 74th Constitutional Amendment has laid down very rigid structures. So the representation of the community comes in the form of an Anganwadi worker
absolutely.
or a health worker.
Yes.
We don't know whether they are representing the community views. Then urban areas, large cities, their wards are huge. It's very difficult to build a system where you have a whole large, several smaller community-based organizations that then aggregate together or confederate together at a ward level, at a neighborhood level, then at a ward level. So it is a structure that needs time to build, but it'll only, people lose. If I'm a poor person, I'm on an existential, I'm surviving, I'm only looking at my existential needs. If I need to come and participate in this, I should feel that my ideas are being valued or heard and would be, to a certain extent, if possible, they would be, brought into the plans. But when I find that the city is not listening to me, the city doesn't care. So I don't have the time. I would spend the money. I would rather spend the time earning, making some money, sending it back home because my family needs that. So there is a lot of different moving parts in this, and the city and the lack of city capacity is one critical one.
And so scaling up, you are trying to say that the scaling up can be done only with multiplying it, decentralizing?
Scaling up is another big challenge. So if you look at scaling up, we keep having this thrown at us that, you guys work very intensively. You have so much, money invested in the community engagement processes. We don't have those kinds of luxuries. The fact is that it is not possible to scale. It's not possible to repeat anything in, you can't really copy a model.
Yes.
You can copy an idea, you can copy a strategy, you can, if I pick up Rahul's, housing model, it'll have to be re-evolved or
a process, maybe the systems thinking or a process can be looked at.
Exactly.
Yeah.
And therefore, I think a couple of things that NGOs are now beginning, or civil society are beginning to discover, is how do you work with the governments in the ways that they are used to working. So how do you intervene in their ways of working and nudge the change? And that's what UrbGov is about. In UrbGov, it is about collating and aggregating all the information that's scattered around and is in spreadsheets.
Right.
So we are only trying to put it on a spatial map so that the city can see it. It's making it visible for them. So, and then we, once you get their attention, once you get their interest, that's when they start then bringing in services closer and closer,
Right,
and then making them more, kind of localized.
thank you for bringing us here, Renu. That brings me to a question that I would want to ask Dr. Damodar. Would you throw some light on how the Indore citizen reporting system, how is it linked or not linked with the Smart City Command and the control center in Indore? And how do you think the city are using this data?
Thank you, Ashima. Well, currently there are many systems that Indore city has developed, and they are being monitored separately, not as a part of integrated command and control center. You have a traffic management system, you have citizen reporting system, you have a solid waste management system. All these applications were collecting data virtually separately and not sharing those data.
Mm-hmm.
The effort that we have made is, and by the way, the city did go for integrated command and control center. Now they are in the process of integrating all these data systems into one. And that would be the opportunity to share the data across sectors and try to identify what action should be taken. And we are facilitating training of the human resources in various sectors that will be brought together. And after this COVID pandemic at least eases out. So we are planning for a training program to help them in data analytics, because just collecting data is one thing, but analyzing data across sectors, trying to see the impact of one particular data systems, let's say on solid waste management, on health. Now nobody is correlating those. So that is being done. But as of now, there's a very good system of monitoring of the citizen reporting system. There is 19 zones, and that covers 85 wards. And ward is about 30,000 population to cover 2.5 million. So those, we have zonal virtually cells, 3-4 people sitting across that, totally computerized system, number for each zone, and they monitor all these systems, whether it's CRS or solid waste management, and immediately take action. Right. We have seen it live, and actually this was also introduced to the Makassar group Indonesia, who visited Indore to see this system working.
All right.
Yeah.
That's very impressive, I must say, a city like India. So the smart city is definitely making a difference and improvement somewhere or the other. I have a couple of questions which are very different kind of them, but before that I would want to ask Anuradha a question that I've been holding on to for a little longer. Anuradha, are you there? We can't see you, Anuradha.
I think somebody, okay.
No, now we can. Yeah, now we can. So I would want to, since you come and represent USAID, which is a donor agency, I would want you to throw some light on what do you think from a donor's perspective? How do you think we can have or we can promote an enabling environment for appropriate interventions and successful interventions in the habitats for the urban poor? How do you think these can be actually successful from your side, from say USAID side? So if USAID is giving money, what do you think you would be looking for towards that interventions? Some bit of it you did touch upon in your conversation, but I thought that we'll probably look at it a little more.
Okay, so, I think, Ashima, it is something that is not about being a donor or not being about a host government. I think the principles remain the same, whether you're a donor or a host government, because we being donor also are spending money of taxpayers sitting in US. So what we want is that, once you've spent this money, whatever we do, really gets scaled up. When I say scaled up, it does not matter in terms of just the sheer quantity volumes that I'm talking about. What I'm talking about is scaling up maybe in a small geography. So maybe I pilot something, or we pilot something in the city of Indore in, say, few slums, but the city government takes the ownership at some point of time if they like the model, and take the onus of taking that model to the whole city. And so that's, I think, our first mandate when we enter in the city. And that's why, years back we were trying, we when it was almost 20 years back, we came with a push mechanism somehow, but of late we have stopped that, and the way that we work is a pull mechanism. So before we enter the city, we very clearly talk to the city governments and the municipal corporations, and kind of take them in confidence and say that we are going to come up with this model, and we conceptualize the model right from the day one and start implementing into the cities with their understanding and with their guidance, of course with the communities in consideration. And once you and as we go along, we innovate, and we also tell the governments of how to take it forward and build their capacity to take it forward. So the whole idea is scaling up, and the ample steps that you need to scale up are taken so that the city scales up whatever we pilot in the city. That's the first element that we move in. Second is that we make sure that we involve the local organizations that are existing in that particular city, rather than bringing a high-flying foreign university. We still may bring them for data collection, because there are certain elements of monitoring that sometimes the local universities do not have capacity. So I'll give you an example. We got in a GIS mapping system in the city of Indore, and that funding came from State Department of Geography in US. But we didn't implement through that department. The department brought a technical agency, and the technical agency in turn empowered a university in Indore itself, and that university used its students and its faculty to then go and do this GIS mapping with the smart city. And when we left the capacities with the university. The university was quite affordable, and the local government is able to work with this university, and the students are still there in revolving basis. So the smart city now still gives the data to the students. The students, pro bono works on this GIS work that is going on in the city of Indore. So it's like creating that system of local institutional capacity building, local, set of managers, local set of implementers who are in the buying capacity of the municipal corporation, leave them with that capacity and then move out of it. So I think that's the second mantra we have always followed and we are still following. And the third mantra that we have in mind is we always enter a geography with the exits in our mind. So it is not that we ever enter in any program thinking that we are going to stay here or support in eternity. That's not the mantra. So beyond sustainability, it is also, that you have to live. So you have an exit strategy, you hand over it, so we create tools. We actually create tools. Renu has referred to that, how do you actually replicate some of these things? So, a chocolate recipe, you cannot create a chocolate recipe without chocolate, the basic ingredient, and without sometimes sugar and milk. So, the tools has those basic elements that are needed, and the rest of it is a contextual knowledge base that would come when you enter another city. So we create those tools and we try and create that body of knowledge by creating a virtual university, or by creating, that local institutional building, so that they act as a center of excellence and take this whole knowledge base forward. So those are, I think, the three basic points with which, as either a government or a donor, we all enter into this development business. And I don't know, we have been trying and we have been successful in a lot of things that we have done till now, and we have actually handed over some of the projects in Rajasthan and other states and cities where we have actually handed it over to government, and we have moved out, and we have very, very successful example. And one of the models is Dr. Bachani's project that he is doing.
Right. Thank you for that insight. I think very, very well put. And this is a fact and a matter of, yes.
I would like to add a couple of points. One, the NCD survey that I talked about, again, we utilize the local institutions like MGM Medical College, the Department of Community Medicine, the Government College of Nursing, and the Indore School of Social Work. And they gave us staff as well as students to do this survey. So we are leaving behind capacity locally to do these surveys periodically. The second thing what Anuradha just mentioned, we also have a dissemination plan in mind. There's already a discussion going on. It was going on with the state government. They wanted to have this approach introduced in other smart cities of ME. So we're planning a regional workshop there, but because of COVID, it got postponed. But we have in mind a dissemination workshop where we'll share the approach with other smart cities so that they can adopt this model. I mean, it's a demonstration project. They have to think about.
Yeah, I think creating systems, creating processes is more important than creating one solution, because cities are not static entities and they keep on moving. Reiteration of these models is something that's very critical. A couple of questions that we've come from the audience, more just few of them. I don't know who would want to answer them. I'm just putting it on the floor. Would inclusive and recognized developments catering to vulnerable people's need affect or cause gentrification? That's something that's very, very critical that happens, and particularly it's visible wherever we are seeing PMAY getting implemented or even affordable housing projects getting done. And another one in the same lines is, how can planning improve vulnerable neighborhoods without gentrifying them? Renu, would you want to take that? Yeah. You're on mute, Renu.
Yeah.
Yes.
I have a very strong opinion on this. And I do believe that there are choices we have to make. And we can't keep the poor in bad conditions just because we don't want those areas to gentrify in the long term. Okay, that's my first point. My second is that our data has shown that investment in the infrastructure and service provision in these communities actually gets the cost is recovered within 3 to 5 years. Within 3 to 5 years, people are healthier, people are more productive, women go back to work, children are in school. So there is an intergenerational poverty reduction impact. And I do believe that all of us grow, and people in the general population also keep changing houses. They move on, they move from one place to the other place. So why do we want to keep the poor, in those unsanitary conditions? I have a very strong belief that we should allow certain basic services to come into, and once people start valuing these services, they're going to protect their own spaces. They may not want to move. You are closest to your work. You also have a good house. I mean, look at how many people live in Dharavi and who are,
Unfortunately, Renu, in some cases that I've particularly seen, some of the cases that happens at the moment you improve these spaces and provide for these slum areas, suppose a relocation or redevelopment of a slum, those slum people will sell it off or let somebody else come here and then move to another slum.
So that's where your data and technology comes in. You can use technology and data today to not give a family a second house. So that's something that if it's a subsidy, that's the concern.
Yeah.
There's enough IT software now available for you to weed this out.
Right. Yes, Rahul, you want to add something?
I would also like to reply to that, because see, there are the 2 points. Number one is that, because we are all talking about housing as a property, that is when this whole idea comes, that if you improve the infrastructure, you provide a better housing, people sell it and go. But the housing does not have to be only treated as property. If you understand the fact that people are looking for accommodation, that you can develop a rental system, then that idea of selling and going away does not occur at all. How can you produce quality accommodation for everybody? That should be our focus. We should not be worried about the narrative of private ownership, housing to be owned, etc., etc. If you do that, then we are endlessly going to be dependent on the vagaries of the market and real estate developers, so on and so forth. Also, I agree with Renu completely about the idea that gentrification is a very specific urban history. Even the word and its whole context emerged in the context of US, the American cities, the relationship between the inner city areas, externally, the suburbs. There is a very strong racialized profile behind real estate industries in that part of the world. In our part of the world, it's very paradoxical. Sometimes neighborhoods, even though they improve, some kind of people will never come there because of caste. Prejudice plays a very big role. Some places never get gentrified, no matter how much you invest, because people have prejudices about certain areas also. So, these are very complex things, and we cannot always use one narrative as a universal narrative around gentrification for all urban contexts. In a society which is so stratified as ours, even gentrification does not happen in the same way as it may happen in other places. So right now, there's so much of urgency in the need for us to respond, to improve the infrastructure, the social infrastructure for our cities as a whole, that we cannot allow these concerns, and certainly not the concerns of private property ownership, as the only entry to improve places. These two things are very crucial.
I think that's very well said. That brings me to a point that you were talking about castes. And how do you say that caste or subcaste, in what has been your experience, particularly in the case of Dharavi, has that become a barrier or a conflict at any point of finding solutions, implementing them, engaging people? Did you find difficulty in the participation of certain intent because of that variation?
Actually, Dharavi within, because it is so diverse, and you have people from different communities, different castes, different ethnic groups, all of them coexisting. But what is common to many of them is there is a certain sense in which they cannot afford, say, the market as a place to purchase a house to live in, and therefore they become part of the story of an incremental neighborhood like Dharavi, where they also have to produce a living, they have to earn a living, and they also have to live over there, and they and they cannot own spaces, so therefore they become part of the occupancy right narrative. Now, occupancy rights are also a legal right. There is a way in which occupancy rights legally can have become a basis in this country for us to recognize that a good accommodation for everybody is very important and necessary. Now, because we do not somehow make this into an operational reality, we do not look. Caste becomes like it's like a soft wiring in our society. It's not always a hard wiring, it's a soft wiring. So it's not intentional. But some neighborhoods which are poor also tend to be where a lot of marginal communities settle down. It may not be intentional, but this is the nature of the way in which economics works. So even a city like Mumbai, which is at one level India's first modern city, self-proclaimed, it actually, all its neighborhoods are divided broadly in terms of class, overlap between class and ethnicity. So there is no operational, intentional, designed way, but this is just as the way, definitely it's not like the racial profiling of urban neighborhoods which happened in the US, where race was an active principle. It was actively used by financiers, speculators to create neighborhoods where African Americans were prevented from moving into richer neighborhoods. That kind of organized discrimination certainly, I would not say, exists in India. However, it is a soft wiring in which class and caste overlap, and poor neighborhoods tend to be dominated by marginal communities, and those communities often have low capital. And in an economic context or in an urban context where right now private property and real estate development seems to be the only entry point through which we can improve neighborhoods, there seems to be no space for many of the communities. So this is the way I would explain it.
Renu, would you want to add something on that?
I think Rahul has put it very well, and I entirely agree that somehow caste does get flattened out when you come into an urban environment, an urban context. The very heterogeneity of the mix that you see in the slums, and you are not known by your caste. So your identity, you have several hats that you wear, and I think the hat of your probably your occupation, probably the level, your socioeconomic status is a bigger hat, and therefore it assumes the caste hat. That's the kind of what we have observed on the ground, and it's not that it's completely wiped away, but we don't see them, but there are instances.
But it does emerge and kind of resurface at some moments of.
Yes,
sometimes.
it would. For example, we in one of our studies we did find behavior study on usage of community toilet, and one of the factors was disgust. One of the factors that came through was that people felt a sense of disgust that the person in front of them came from a different caste group. So it was, I mean, it is there. Maybe it's very subliminal. Maybe it's very subconscious level, but. I think the mixing that you see in urban areas actually to a large extent, I think does dilute this.
That's right.
Can I say something here for a second?
Yes, Anuradha.
So
your video is off, Anuradha. We can't see you.
Okay. I'm
yes.
so sorry.
Yeah.
So I'm not an anthropology expert, but I have some ground experience that come from working in various cities. And I think this caste and subcaste system in cities like Mumbai, Delhi, Chennai, Bangalore, so they are overpowered by, I think, the class structures. But when it comes down to the secondary and the tertiary cities, which are still more nearer to the rural environment and which do not have these boundaries of rural and urban very clearly, sectorified, those are the places you still see this caste and subcaste dynamics playing, and where people know each other from that particular village, migrants coming to the nearby city. So I'll give you an example of somebody in the district of Ujjain coming and settling down in the city of Ujjain. So there you would know which village this person belongs to, and hence that intersection or that dynamic still plays. But I think as you move towards these larger cities, it starts getting, and
diluted.
Maybe Rahul and Renu can answer better.
Yeah, absolutely. So I think we were already 2 hours through in this webinar, and let me quickly wrap up. I think we had an amazing, a very diverse kind of discussion that was around. Just to kind of sum up a lot of things, there were various things that came up, takeaways, to say that yes, designing for the vulnerable population, these areas is not that easy as we do it for the rest of the city, because of the sheer organic nature of these settlements. There is no one-size-fits-all solution. There's no one model that can be replicated, copied. It has to be contextualized. It has to be more process-driven. And it's a process which can actually help us take the project, the attempt or the intervention through. Also, looking at the case of Indore, it was very interesting, even the way the technology is being used in the citizen reporting system, and the way the slums are getting kind of cleaned up and maintained. It's kind of commendable to see, and something to look forward to as a positive thing that other cities can learn from. The various models like what Renu talked about in terms of engaging public and involving them from the design and even the conceptual part itself all the way to implementation, like what Rahul does, and also Renu, what you've been doing. You know, the whole idea of having a collective approach, because it is for the collective good and the collective rationality of the entire process that has to happen. I think that's really something that has come out very strongly in this discussion. Also the URBGov, we did not get too much time, Renu, to discuss that, but that's a very interesting actually intervention that has happened, and I hope that many of the cities would take benefit of it, or if not, they are right now. And localized solutions, and to make people partners. So these are kind of repetitive kind of suggestions and central themes that have come up, which were very, very interesting across the whole thing. And more importantly, to take full benefit of the fact that we are involving the public is for letting them take the onus of the whole thing, letting them take ownership. And they are the one who take it forward and ensure it's working, and it's not a one-time effort, and it doesn't stop the moment an urban local body stops working in it, the moment Cure stops working, the moment URBs start working there, on the moment BHC stops working there. It should not stop. It has to be something that has to carry forward. It's only if we can empower and aware and strengthen our local communities to that level, can we actually ensure a longer kind of an impact that can be visible in the cities across. I hope I'm able to summarize all the points. There have been very good questions, many more of them, which we have not been able to address because of the time constraint, but we will definitely reach out to you. We will compile all these questions, and within a week's time, we will have our panelists answer them appropriately, and we will share the answers to all the participants who've asked some questions. Thank you very much. Thank you, the panel. Thank you for taking out so much time, and it was a wonderful discussion that we had. I learned so much. Thank you.
Thank you, Ashima. Thank you,
thank you,
Renu
everyone.
and Rahul.
Thank you very much. Have a great evening. Bye.
Bye, Ashima. Bye, Rahul.
Bye. Thank
Bye,
you.
Bye,
Anuradha.
Bye, Renu.